Hi, my name's Tori and I wish I knew more about blood products.
Hi, my name's Letitia. I wish I knew more about taking care of myself when starting shift work.
Hi, my name is Lydia. I wish I would know more about how to work as in a team and solve conflict.
Hello, welcome to Five Things, the nursing podcast from the Royal Brisbane and Women's Hospital. My name is Liz Crowe.
I'm Jesse Spur, and this is a podcast by, for and with the amazing nurses and health professionals in our corner of the world. We hope to connect with a global community as we move from surviving to thriving. Welcome to Five Things.
Hello, my name is Liz Crowe.
I'm Jesse Spur.
Welcome to another episode of Five Things. And today I'm very excited because we've got Esther Cohen, who is the nurse practitioner for HIV and sexual health here at the Royal Brisbane and Women's Hospital. And we're going to talk all things sexual health. Welcome, Esther.
Thank you very much. It's lovely to be here.
We're excited to have you, and I know this is a topic that Liz is quite excited about.
He's very cheeky, isn't he?
We'd love to get to know your origin story because in so many of these roles we go, I'm making some big assumptions that this wasn't where you started your nursing career thinking you'd end up.
That's not an assumption. That's the absolute truth.
Yeah,
yeah, no, that's right. I didn't start my sexual adventures early, I have to say. I went into nursing when I was 30. I've completed my education at 30 and I was in intensive care for 20 years, which I loved. And then I did my nurse practitioning, and unfortunately it's very difficult to get into nurse practitioning in that area. So I went into trauma and orthopaedics and then primary care and found that I really enjoyed working in the sexual health area. So then a job came up at the Royal Brisbane and I went for it.
I didn't know that.
Yeah.
What an interesting pathway.
Mm. Yeah.
And now
It's
we've
all
got you
to do
for
with
life.
beds. Yeah.
So, Esther, your number one is, what is sexual health and why is it relevant to the bedside nurse?
It is indeed. So sexual health is, it can be taken in so many different ways. For us and our department, sexual health is more to do with infection, controlling infection, treating infection, stopping infection from spreading further, education, and it's also into the bloodborne viruses that are not necessarily STI transmission always, but it can be. So things like Hepatitis B and C as well. And it's about protecting people and educating and trying to find an environment for people where it's a safe place to respond with no judgment.
It's funny, isn't it? Because we live in a very sexualised world would be the way I would assess things. You know, like even across my generation, what you can now see on TV, what you can access with relation to films, pornography, you know, it's a huge market. And yet people can't talk about sex. Like, what is that?
Exactly right. And I've been thinking about this a lot now and that I was coming on to do the podcast, and it's a really interesting fact that sex sells. Basically, sex and money make the world go round, but people are really, really scared of talking about it, or they feel embarrassed, or they feel judged, or they feel the perception of being judged. They may not be being judged, but they feel isolated maybe in the thoughts that they're having, or the sexual adventures they'd like to have, that sort of thing. And it's a really interesting thing that we do come across quite a lot, is that you kind of think it would be really fun and really exciting, but actually it's not, because there seems to be, unfortunately, a lot of stigma out there still, especially with our HIV patients.
And so if I'm a bedside nurse, why do I need to consider, you know, like I've got so many other things to worry about. How come sexual health has to be part of that assessment?
That's a really good question. Because of the effects that these sexual infections can have on a patient, there are some chlamydia and gonorrhea, things like that aren't obviously life-threatening, but it should certainly be brought up as part of your assessment with people, because quite often, unfortunately, the children have no education in high school. That's what we're finding a lot. Children seem to have no education, and it's going back to what we talk about nobody wants to talk about sex. So parents find it a really tricky subject to talk to their children about. And teachers sometimes have barriers in place. And so it's trying to normalise it as part of the healthcare environment, that it's okay to ask about these things and it's okay to talk about them. So, for example, if somebody's coming in and they've never had a syphilis test, it's a really great time to catch them. Same with HIV, same with hepatitis, check their status, just to see where they're sitting and get it a much more normalised approach as you would any other health issue.
I have no idea about this, but, how often would a GP, just as a routine annual checkup, say to someone who is sexually active and potentially, more adventurous, using your word, how often do they just naturally screen or have conversations, in your opinion, like around sexually transmitted infections?
Well, I think the medical professional and healthcare professions in their entirety are not immune to having issues with talking about sex. And we do get feedback quite a lot that young people especially are rarely asked unless they have symptoms, and then they'll go. But I wouldn't know the statistics on that one, but I would say those statistics would be very low, especially in the groups of people who have sex with the opposite sex. I would suggest, when I worked in primary care, if there was a young gentleman coming in who had sex with the opposite sex and he was coming in for a stubbed toe or something like that, I would ask him when he last had an STI screen, and more often than not, he would never have had one in his life.
I think this leads us beautifully into your second point, which is most STIs or sexually transmitted infections have no symptoms. So I'm very curious, given that we think that most people don't talk about this. First of all, what remain the most common sexually transmitted infections? And if they have no symptoms, how on earth do you know you have one?
That's a great question. Chlamydia and gonorrhea remain our top two. They do have symptoms occasionally, and that's usually pain when you pee, discharge, all the lovely stuff. But most of the time they don't have any symptoms, and the only way you can tell is through screening, or if somebody that you've had sexual contact with has then themselves contracted symptoms, and then they go and get treated and tested, and so then they're a contact and they'll get a phone call saying that. But otherwise, there isn't many ways of telling. Same with HIV. Some people can get some sort of symptoms. They might have a flu-like illness, or unfortunately, if they go undetected for a long time, then they get very ill. But more often than not, they have very, very few symptoms. And the only way we can tell is through testing.
So there's chlamydia, gonorrhea, HIV. What other things should we be thinking about or have knowledge on?
So there's trichomoniasis, which is another nice one. There's also bacterial vaginosis and thrush. Neither of those two are STIs, but they do come with symptoms, and we do pick them up quite often. And they generally present, the bacterial vaginosis is only presented in females, but thrush can be male and female, but it's mainly females.
So if a man has thrush, can he give thrush to a woman, or it's not infected?
No, it's generally not transmitted that way.
Really curious, given that we're saying a lot of STIs are asymptomatic or like low clinical symptom load. Is there modelling to sort of have any idea of what sort of prevalence of STIs there is in the community? I'm putting you on the spot with that, but like when we're talking epidemiologically, if we're only seeing largely the occasional contact tested person because they've had a known contact test positive, and then just some opportunistic encounter proactive screening, do we know what sort of prevalence this is in the community?
You have put me on the spot. I don't know, but it's a great question. And the truth is, I don't know if anybody knows that. Because if you're not testing, then how would we know? People are, there's lots and lots of programs out there trying to make STI testing more accessible. If we had more funding, more staffing, it would be fantastic on a Saturday morning to go out and just say, just come and get tested, do your vaginal swabs and your Ps here. It would be brilliant, but unfortunately that doesn't happen. There are some services where you can send off for chlamydia and gonorrhea screening. We do try and promote the asymptomatic screening. We've probably got more understanding of men who have sex with men's rates, because if they're on PrEP, then we see them every 3 months for asymptomatic screens. So that helps. But trying to get it out to the public of just come in, get yourself tested. It's really quick and easy, and it's not embarrassing. That's hard. That's a hard message to get across.
If it's a vaginal swab, surely that is embarrassing.
No, because they do it themselves. Yeah, there's no evidence that a clinician doing it provides any better service than the person doing it themselves. So we just offer it to them. They can do it in the loo.
So if I'm a young nurse, of however I identify, and I'm listening to this podcast and I think, oh, I occasionally have unprotected sex, given it's asymptomatic, why should I care? Like, why should I care if I've got a sexually transmitted infection, if it's asymptomatic and it's not causing me problems? Like, why is it so important to understand if you have an infection?
That's another great question. So for chlamydia, and especially for females who have chlamydia, the more often they have it or the longer it's in their system, it can lead to infertility, and it has led to significant cases of infertility. And the gonorrhea, although it can be asymptomatic, people can clear it. People can clear their own chlamydia as well. It can lead to longer-term complications as well. Obviously, with the HIV and syphilis, it's fairly self-explanatory. But for the hepatitis, again, that can lead to long-term liver damage if it's not picked up.
Yeah. So even though it's asymptomatic, you want to know.
Absolutely.
Because it can have other health consequences leading down the track.
Yes.
So it's something important for us to think about, both as healthcare professionals but also as individuals who are having sex.
Absolutely.
And I guess then the communication impact on partners as well, because it might manifest differently with them.
Yes, absolutely. And they do have a website that's called Let Them Know. So if people are a bit anxious about telling somebody face-to-face, they can just put the person's mobile number if they know it, and that'll just send them an anonymous message saying somebody that you've slept with has had. It's a bit old-fashioned saying slept with, but you know what I mean.
There wasn't much sleeping going on.
Not much. But yeah, that will let them know to go and get tested themselves. And I think that's another really great point, that it's really important to try and sort of foster this idea of it's a no-blame situation. So men who have sex with men seem to do it really, really well. If they come in and they've got chlamydia and gonorrhea everywhere, they say, talk to them about contact tracing, which is really important. And if they know who the person is, they say, oh yeah, that's no problem. I'll tell them. They'll, because they seem to have more of a understanding that you're going into this. If neither of you are using a condom, this is a possible consequence of having sexual contact. But I personally, and this is anecdotal, that people who have sex with the opposite sex are much more worried about telling people that they do have an STI, especially females, because they're worried that they're going to get blamed, and the slut shaming and that type of thing. And when I reference females and males, it's important for me to say I'm talking about the sex that you were born with. That's irrelevant of gender.
Yep.
And continue with the path of just assuming absolutely no knowledge in this. I'm going to ask the question. So Liz and I, separately, come into the clinic and are keen to have a sexual health screening done. I choose Liz and I because it gives us a male and female sex assigned at birth combo for us to talk through any similarities, differences. So what is the screening process like, and what is screened for?
That's a really great question. It does depend rather on the answers, and if you're coming in for a screen for the first time, there are some invasive questions that we ask. And it's not because we're nosy and it's not because we're jealous. We just want to know what type of sex you're having and who with, so that we know how to screen properly and effectively for you. So take, for example, if somebody came in and said they were a male who was having sex with females, no oral sex, and always uses a condom, for example, we'd praise him, and I'd like to get him a statue made of him in gold, because there's not many of those around.
No oral sex? I think we're praising the man with no oral.
No, sorry, I meant condom use.
Oh. No. Not praising the man with no oral sex.
No, we're definitely not praising the man with no oral sex.
Sorry to distract you. Okay.
So, condoms. Yes, it's unusual for people to use condoms every time. But if they're having sex with other women, it would just, for men, as usual, it's a bit easy, and it's just the first part of their pee that we need. So it doesn't have to be first thing in the morning. It just needs to be about 2 hours after they had their last pee, just so that we can catch all the bacteria. And it's just the first part, so they only need to fill up the specie pot about halfway. The females, on the other hand, it's a bit different. They do the vaginal swab because it's more effective at picking up infections, and a throat swab mainly for blowjobs. That's easier to contract through blowjobs. And the men who have sex with men, we offer them a rectal swab for them to do themselves, and throat swabs, which we usually do for people because it's quite tricky to get down the back of your throat, and a first catch urine. And in turn, anybody that is having anal sex, then we ask them to do a swab for themselves as well. But most of this they can do themselves. If they haven't had an HIV test ever, or syphilis or Hep B, then we try and get that checked out as well. Some people are quite scared or think they don't need to. It's still a massive stigma, but we just encourage. Obviously, we don't force anybody to do anything, but if we explain at the beginning, this is why we're asking these questions, because they can be a bit invasive.
So it's not a blood test?
The HIV and syphilis is a blood test, yeah.
Right. From a prevention point of view, are condoms still the greatest way of keeping both partners safe?
They absolutely are for everything other than HIV. Condoms are still excellent to protect you against HIV, but there is also PrEP medication that can prevent it as well.
Yeah, terrific. So your number 3 is syphilis is on the rise. And when I think about syphilis, I think about, the royal family in the 1700s and, how devastating it was. But in saying that, I actually don't know anything about syphilis. So can you tell us, firstly, what is syphilis and why is it suddenly on the rise in the year 2023?
Absolutely. So syphilis is, as you've rightly pointed out, it's the oldest. They used to call them venereal diseases after Venus. So it is the oldest of the STIs, and it's a bacterial infection that it's a very tricky, they also call it the great pretender, because it's easily transmitted through ulcers. And
ulcers just in the genitals?
No, so you can get any membrane where the syphilis has entered. So quite often we see a mouth ulcer if they've had oral sex, and that's where the syphilis has entered. And quite often it shows itself. If it's going to show itself, it will show itself as an ulcer. That's at the primary stage. It's painless, and people tend to sort of look at it and go, "Oh, I need to get that checked out," and then it disappears within about 6 weeks. So then people think, "Oh, well, that's okay. It's gone. Whatever it was, it's gone." And then the second stage is. So it can show itself as having a rash, all over body rash, and a rash on your soles of your feet and the palms of your hand. But again, it doesn't always show itself. You can get temperatures and things, but it's all quite transient. So by the time somebody thinks, I really ought to go and get this seen to, it goes again. And then it can run the real risk of going right underground where it's not infectious anymore, but it sits in your brainstem and it sits in your spinal cord. And that's when, in the old days, it used to kill people. You'd get parts of your nose and face and arms falling off. And used to send people mad. My great uncle actually died of syphilis.
Oh, really?
Yeah. Very proud of him.
Blazed the trail for your career.
Yeah, but Napoleon died of it, Al Capone, Toulouse-Lautrec. Lots of people did, but it's a really easy treat. It's painful. It's 2 jabs in the bottom, but it's a really easy to treat. It is tricky to be able to sort of decipher from your investigations how long they've had it for. And if we don't know how long somebody's had it for, then we treat them over 3 weeks with the penicillin injections. But generally, if people are getting tested regularly, which is what we absolutely encourage, then we can treat them with just 1 jab. We think it's increasing again because of people living in remote areas. It's highly prevalent in men who have sex with men, but it's also more prevalent now, unfortunately, in the First Nations population. And if somebody has syphilis and they're pregnant, then it can cause congenital syphilis. And unfortunately, we've had 13 deaths in the last 20 years with babies, either stillborn or in utero, from it, when it is a preventable disease, and it's something that we should, all be trying to get tested for. So if anybody listening has a female patient who's pregnant or about reproductive age, we really would encourage them to get tested.
So again, I guess going back to, if I'm listening to this, I'm sexually active. I always have the intention of making my partner wear a condom, but sometimes I drink a bit too much or we just get carried away in the moment.
Just clarifying, this is a hypothetical.
Yeah.
Nick,
absolutely.
It's okay.
Absolutely hypothetical. But how, should I consider, if I've got no symptoms but I've been sexually active, I've only had a couple of partners, how prevalent are these STIs or syphilis that I actually need to understand what my risks are?
They are. It's a great question. And again, because there's no symptoms, it is tricky because it's something that you forget to do, especially if you don't have any symptoms. But we recommend men who have sex with men that are active, super active would be about every 3 months if you're having different sexual contacts. And for people who have sex with the opposite sex, we recommend between every 6 and 12 months, depending. If you've got a really super high turnover, every 3 months is a good
As in
rule
super
of thumb.
high turnover of partners.
Of partners, yes.
Okay. All right, good. All right, so your number 4 is about HIV and AIDS, the facts and the myths, and it's actually World AIDS Day today, isn't it?
It is indeed, yes.
So I, want to preface this that I grew, I was around in the 90s when, AIDS became a thing, and across the world there was so much fear, there was so much death, governments were so slow to act. Everywhere you went there was, promotion of condoms, there was an awareness about HIV and AIDS. It's so interesting that my young adult sons don't have it on their radar, don't think about it. So what are the real facts and myths in the year 2023 about HIV and AIDS?
Okay, so the facts are that HIV is still alive and well, but the myths are that AIDS is alive and well. So HIV is the human immunodeficiency virus, and AIDS is a consequence of no treatment, which is mainly terminal stages of the disease. We really don't see AIDS in Australia, thankfully. It's probably prevalent in other parts of the world, especially Africa, South America, but here it's not something that we see regularly, thank goodness. HIV is completely controllable. by taking, in most cases, 1 tablet daily. That's it. And it reduces the viral load, increases the CD4 count, and means that people can live a productive life. They can have children, and if they have an undetectable viral load for 6 months, they can't pass it on to partners at all during sex, even without a condom.
So I'm heterosexual. Again, this is hypothetical, Jessie, but I'm heterosexual. I'm sexually active. I don't always, insist my partner wears a condom. How prevalent is HIV in our community, and how often should all people who are sexually active, keep it in mind as a real risk or concern?
So generally, people who have sex with the opposite sex are at lower risk. So there is a much lower risk, and part of that is to do with how you can contract it. And we know that anal sex is one of the condomless anal sex, that is one of the easiest ways to contract HIV. But HIV itself is actually quite a hard infection to catch. So it is less risky, but it's still important to get yourself tested every 6 to 12 months, and it's really important to have a baseline. So if you get tested even once every 12 months, it does depend on how active you are sexually. The other thing that's important to bear in mind with heterosexual people is that you don't know, and I'm not harping back to the old advertising days of, you don't know who you've slept with. There was that whole thing going on about the different beds and things. But you genuinely, and working in this environment, you genuinely don't know who your partner's last slept with, especially with the stigma around men who have sex with men. They might be very reluctant to let you know that they've had a encounter with a partner of the same sex, and that is a higher risk, I should say, if they're not on PrEP, or if they're not on any treatment for their HIV. Men who have sex with men are at higher risk, as are people who use and inject drugs. And again, that's quite common, and it's something that we ask, and everybody would be amazed at the amount of people that will say, yes, I do, very occasionally. And they may not be as careful about not sharing needles as people who actually do it regularly.
So even heterosexual people, it's not zero risk for HIV, and it's not zero risk for STIs. So it isn't something we all need to be considering with our patients and with our own personal lives.
Absolutely.
So Esther, again, playing the ignorant here, you've mentioned PrEP a few times. What is that, and and how does that affect your risk profile?
That's a great question. So PrEP is part of the HIV treatment. It was initially solely for HIV treatment, and it stops HIV being able to replicate. So people who are high risk, we recommend that they start on PrEP. It's 1 tablet once a day. It's mainly taken up with the MSM community.
So what's MSM?
Sorry, men who have sex with men.
Right.
Community. And it can be taken on demand, or it can be taken every day. And if it's taken effectively every day, it can reduce your risk of HIV transmission by 99%. So it's really effective, and that's without using a condom, which means that it's very low risk of HIV transmission. But of course, people not using condoms, then syphilis goes up, gonorrhea, chlamydia, those things go up as well.
So are you saying that men who have sex with men might opt to just take a HIV PrEP almost prophylactically rather than take the risk of contracting HIV in the first place?
Absolutely, and it's readily accessible. You can get it from a GP, and obviously we prescribe it. But there's lots of online places now that just deal with PrEP. It's one of the best things you can do to protect yourself, especially the younger population, because let's face it, sadly, they're the people that are having the most sex, and not somebody in their 60s, although I'm not ruling that out, but somebody who's young, they are having higher amounts of sex, and that is the riskiest time for them to contract something. So this is so effective that I think the statistics are that if we could get 1 million people onto PrEP, we would reduce HIV transmission almost altogether in Australia.
Yeah, wow. And when you're saying sadly it's the young people having the sex, do you mean it's sadly for those of us who are older?
Absolutely.
Yes, I thought so. Can I ask, Esther, as I said, when I think about the 90s, the terrible shame, even for people who had contracted HIV via a blood transfusion, how much does HIV still attract a stigma these days?
Yeah, unfortunately, there is a massive stigma still. People who do contract HIV, they have massive shame, and it's not just the people who contracted it. And we do have some people that contracted it in the 80s, and they're still with us, thank goodness. But it's not just that cohort of people, it's people who contract it in 2023. There is a perception out there that they're dirty, that they've been having too much sex. I don't know if you can have too much sex, but there's a perception of that, or the wrong type of sex. And I'm using air bunnies there. The wrong type of sex, maybe being promiscuous or being with somebody that you shouldn't have, or using IV drugs. We have some older patients who will come in and tell you straight away, I got my HIV from an infusion, because they're still so stigmatized. And it's unfortunately we have had instances of healthcare professionals continuing that stigma with some awful examples of being outed in front of lots of different people, and not all healthcare professionals do have a clear understanding. They're double gloving. They're telling people, watch out, you've got to, this person's HIV, and it's enough for them to have to live with it without us just reinforcing that shame for them. So I don't know if it's ever going to go. Maybe eventually it will. I don't know, and I'm not that old, but maybe in the 17th century with syphilis was the same sort of shame. I don't know, but I'd like to see, obviously we'd all like to see that stigma goes, but I don't know if it ever will, because the Grim Reaper, all the advertisements, it's a double-edged thing, because it was really effective and you can't negate that. But at the same time, it has brought about this real stigma that, there's something dirty about HIV that just doesn't carry with other chronic illnesses.
So number 5 is hepatitis B can be prevented and hepatitis C can be treated. So I want to start with, what is hepatitis B and what is hepatitis C? How are they different?
So hepatitis B and C, there's lots of different hepatitis actually. There's D and E as well, and there's A. But hepatitis B and C, so both of these can be transmitted through blood, and they can also be transmitted through from mum to baby, which is called vertical transmission, same as HIV and syphilis. They, generally speaking, hepatitis C is a bit invisible for quite a long time, and it stays invisible until later life, and then it becomes a real issue, whereas hepatitis B is more of a chronic issue. You can clear hepatitis B yourself. It's unusual to clear it if you've had a transmission as a child, but it can happen. But there is treatment to suppress the viral load, which is similar mechanism to the HIV medication. But the great thing about hepatitis B, although we can't treat it in every single case, we can prevent it with the immunisation scheme. So all kids, babies and children have the hepatitis B. And in sexual health services, we check regularly. Every time people come in, basically, we check, if for the first time, we check whether they're immune or not. And if they're not immune, we encourage them to get their course of vaccinations. It can take a while. Some people need more than 3 vaccinations to get immune, but eventually most of us do become immune. I had to have 11 vaccinations.
Oh my goodness.
Yeah, I'm a bit stubborn, me, but yeah. So there is, and once you're immune, you're always immune. So that's really good. And the hepatitis C used to be a really difficult one to treat. It was IV infusions over a long amount of time. It was really made people feel terrible, sort of almost akin to chemotherapy. But that has all changed now. And once it's been identified that somebody's got hepatitis C, it's generally a course of tablets over 12 weeks, and then it's eradicated. The thing with Hep C is that even if it is eradicated, it will always, it's like a footprint in the sand. It will always show up in your blood test that you've had it, but that doesn't mean it hasn't been eradicated. We just check the RNA viral load, and generally that'll say negative, and they're done and dusted.
And is hepatitis B and C considered a sexually transmitted infection?
That's a really good question. There are some instances, and that does seem to be increasing a bit. And I think they're doing quite a lot of research into why that's happening. But it is with mainly IV drug use or vertical transmission between mother and child, and from overseas where they don't have Hep B vaccination programs, we do see that as well.
And what happens, like why is hepatitis B and or C dangerous for us?
So long term, it can cause significant damage to your liver, and it increases a high risk of liver cancer. So people who, even if they've cleared either of the hepatitis, depending on what their blood results are and what their liver function tests have been like, whether they've developed fibrosis or cirrhosis, they have to undergo monitoring for liver cancer for the rest of their lives, which is, every 6 months. That's a big chunk of ultrasound to have every 6 months.
Yeah.
That's a great spot for a plug back to our episode with Olivia Cullen on 5 things about the liver.
Yes. It's a wonderful organ, the liver. We need to look after it.
Okay, I'm going to try and summarise everything you've just taught us about sexual health. So number 1, what is sexual health and why is it relevant to the bedside nurse? And I guess what you were saying is sexual health is about the infection prevention, infection control, infection education, and the bloodborne viruses that are spread either sexually or through IV drug use.
Absolutely.
And I guess why it's relevant to the bedside nurse is because professionally, nurses are often the only people who might have the courage or the foresight to ask people about their sexual health.
Or the context and opportunity as well.
Yep, to ask. And personally, it's because hopefully most of our listeners are sexually active, and so having a screening every year should be part of a general health follow-up anyway.
Absolutely. If you're changing partners, absolutely.
Even if you're not changing partners, because we would like to think that everybody is faithful, but that's not always the case.
That's very true.
All right. Number 2 was that most STIs have no symptoms. And so you were saying this is really tricky because most of these sexually transmitted infections can actually lie dormant, have no symptoms. We don't know if we're carriers. We don't know if we're spreading. We don't know if we're at risk. But you were saying there are some serious long-term health consequences for a number of these infections if they're not treated. And the one that really stood out for me was chlamydia and infertility. But certainly for syphilis, for all of them, they can have long-term health consequences. So it's really important that screening is used because we may not have any physical symptoms.
Absolutely, yep.
Number 3 is syphilis is on the rise. And so you talked to us about, that syphilis is the longest known sexual infection that has existed, and it usually presents initially as an ulcer. And it's tricky because it can present in the mouth or in the genitals, and we think, we need to do something about that, and then it disappears. That it's often like a hidden kind of infection, and that it can present as a rash, and then we think, we need to do something about that, and it disappears. But syphilis can be extremely dangerous long term, and one of the biggest concerns is also congenital syphilis and the impact it can have on the unborn child. The good news is that once it's detected, it can be easily treated with a penicillin injection or, a course of that. Number 4 was HIV AIDS, the facts and the myths. And I guess what I really took home is that HIV as a virus is still very much a thing in our community, and that there are populations, particularly men who have sex with men who remain vulnerable to this virus, but that AIDS, which is the consequence of no treatment of HIV, so that's an important distinction, really doesn't exist anymore because we can be so proactive about preventing HIV using PrEP, which is the HIV treatment, and that some men who have sex with men just choose to be on this PrEP prophylactically, which really helps reduce HIV, and that when people have HIV, when they take their meds, which might be 1 tablet a day, it really means it's no longer a huge issue.
Absolutely.
So the stigma that has, I guess, remained around HIV and that people are promiscuous or that they have to be gay or any of those things, it's quite ridiculous, because if you have HIV and you're being treated, while we recommend always still using a condom, particularly if you're changing partners regularly, it's almost impossible to even spread HIV once you're on PrEP. Is that right?
Once you're on HIV medication,
yep.
Absolutely. As long as your viral load is undetectable, it's very, very hard to transmit. And a lot of healthcare issues are a consequence of our lifestyles, and that's just the way human beings are. And it's such an unfair thing to pick out one certain infection against everything else, from smoking to driving too fast to all sorts of different things. So it would be lovely if that stigma was reduced, especially in the healthcare setting where people should feel safe.
Yeah, terrific. And number 5 is hepatitis B can be prevented and hepatitis C can be treated. And you explained to us that there's a whole range of hepatitis with letters from the alphabet, but the reason that we focus on hepatitis B and hepatitis C is that they are transmitted mainly by blood, and while that can be a sexually transmitted infection, that it's mainly often due to sharing of needles with IV use, which is more prevalent than people would believe. And the reason we really need to get on top of this is that hepatitis can cause liver damage, and in some cases it makes you much more likely to contract liver cancers. And also, we need to be mindful that, again, hepatitis can be transferred from mothers to unborn children and can become a chronic illness.
Absolutely.
But the good news is we have immunisations for hepatitis B, and luckily in Australia we're very fortunate that lots of people can receive that vaccination.
Yep, that's entirely true.
I think that's a wrap from us, Esther. What a fantastic podcast. So thank you very much for joining us on 5 Things and talking all things sexual health.
Thank you very much for having me. It's been an absolute pleasure.
The Royal Brisbane and Women's Hospital 5 Things Nursing podcast acknowledges the Turrbal and Yagara as the First Nations owners of the lands we now tread. We pay respect to their elders, laws, customs and creation spirits. We recognise that these lands have always been places of healing, teaching and learning. We also wish to acknowledge the First Nations people of the lands of our global community and encourage our listeners to seek out, listen and learn from the knowledge held in your shared space. As well as all major podcast outlets, you can find us at 5thingsnursing.podbean.com. Please also subscribe and give us a rating on your listening platform of choice. This helps others find the podcast. And finally, if you'd like to connect with Liz or myself on Twitter, we can be found at LizCrow2, and for me, it's inject_orange. We would absolutely love to hear your thoughts, ideas, or feedback. Thanks for listening to 5 Things.